The inguinal ligament number 1 is located between the anterior superior iliac spine A and the pubic tubercle B. By connecting the named spine A with the pubic tubercle with an arch, the outer part of which is represented by iliac bone number 2 and the inner part by the pubic bone number 3. We close the gap under the inguinal ligament. Having drawn an arch from the inguinal ligament to the junction of the ilium and pubic bone number 4, corresponding to the arcus iliopectineus, we divide this gap into two lacunae. The external muscular lacuna is limited anteriorly or above by the inguinal ligament, medially or below by the arcus iliopectineus, and laterally or behind by the ilium. The internal vascular lacuna is limited anteriorly above by the inguinal ligament, posteriorly or below by the pubic bone, and laterally by the arcus iliopectineus. The contents of the muscular lacuna are musculus iliopsoas, number 5, and nervus femoralis, number 6. The contents of the vascular lacuna are femoral artery A and femoral vein V. The medial wall of the vascular lacuna is represented by the lacunar ligament. Fibers of the inguinal ligament twisting towards the pubic bone. Number 7. The part of the vascular lacuna between the lacunar ligament and the femoral vein is called the femoral ring, which is normally covered by the adipose tissue and lymph nodes. The walls of the femoral ring anteriorly inguinal ligament, medially the lacunar ligament, posteriorly the pectineal ligament, a part of the periosteum of the pubic bone, laterally the fascial sheath of femoral vein. Femoral ring is the most common place for femoral hernias to exit, and as a result, the femoral canal is formed. Let's consider its surgical anatomy. The great saphenous vein flows into the femoral vein below the inguinal ligament. Number 8. There it pierces the superficial layer of the latter fascia. This place is called hiatus saphenous, limited by an upper horn connected with the lacunar ligament, and the lower horn passing behind the saphenous magna vein and connecting with the pectineal fascia, the deep layer of the latter fascia. This gap is closed by the cribrous fascia. It is pierced by numerous lymphatic vessels, and when femoral hernias exit through the femoral ring, it becomes the outlet of the femoral canal, the superficial femoral ring. Thus, when femoral hernias exit, a femoral canal is formed that has three walls. Lateral, the fascial sheath of the femoral vein. Anterior, the superficial layer of the fascia lata. Posterior, the deep layer of the latter fascia, exiting from the underfemoral vein. The length of the canal is the distance from the femoral ring entrance to the hiatus saphenous outlet, and it is on average 1.5 to 2 centimeters. In cross-section, bottom view, the femoral canal has a triangular shape.